Now that we have had an opportunity to review how to establish a relationship with a resident, I would like to take a moment to review some of the additional data that is now populated next to this resident's name. For example, for Becky Bok Choi, not only do we see under the location column the resident's room number, but we also see a biohazard symbol. By utilizing the system functionality of Hover to Discover, I can easily see that this resident is currently on contact precautions due to MRSA. Great visibility for anyone providing care or entering that resident's room in terms of what precautions to take. You will also notice to the left of the resident's name a red triangle with an exclamation mark. Again, utilizing the system functionality of Hover to Discover, I can see that yesterday at 2:24, when the Morse-Fall score was documented, this particular resident had a high score of 85. It has therefore placed a high alert next to this resident's name so as to inform necessary staff, etc., as to how they can provide safe resident care. I also see that no allergies have been documented. The reason for visit is testing, because this is a test patient. We can also see their length of stay. In terms of care team members, we can see that nurse practitioner Cheryl Knott is currently involved in this resident's care. And finally, under the activities column, utilizing that functionality of Hover to Discover, I am able to see what medications, patient care, and assessments are due for completion on this particular resident. Finally, I would like to take a moment to show you how we are able to access this particular resident's chart. By simply selecting the resident's name, which is a blue hyperlink, I am able to access their chart, also known as PowerChart. As you can see at the top, this gray toolbar carries forward. You can also see that there is a blue banner bar, also known as the patient demographic bar. We are able to see the patient's name, their administrative sex, their resuscitative status, date of birth, whether they're on isolation precautions, do they have any allergies, their age, any additional alerts, who is the attending, their weight, etc. You will then see over on the left side of the screen a blue menu bar. This is where I am able to navigate to different components within the chart. For example, if I was administering medications, I could navigate to the medication administration record. Or if I'm perhaps documenting vital signs or intake and output, I would therefore select the interactive view and I&O. And that brings us to the conclusion of our microsimulation, where we have reviewed additional details regarding Care Compass, as well as a basic introduction to PowerChart.